Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. So in this video, I want to talk to you about what is a reality for so many people, and that is dying alone because of COVID-19. Now, as part of the circle of life, there's birth, the continuum of health, and death. And some of us it's a longer life, some of us it's a shorter life. But now with this coronavirus, individuals who are tested positive, many of them are quarantined, sick, go through their illness, their family members cannot visit them. It really is just such a sad phenomena that the cultural norms, your social norms, grieving, assisting those around you, and for some ultimately dying alone. Even burials are being affected. So this starts from the hospital. So I ask you to imagine you're an individual. Imagine you're an 85-year-old person. You go for a doctor's visit because if you have shortness of breath, you have COVID-19 type symptoms, and your provider recommends that you go to a hospital. Have a physician have a direct admit, either go through the emergency room or they have a bed for you. So now imagine from that, left your house to your provider's office, you go to the hospital, you're told that you're positive for COVID-19 and you must be quarantined. Your family can't come and visit you. Your loved ones can't come and visit you. Your friends can't come and visit you. So imagine all your previous coping mechanisms, your resources, your support systems, they're available, but they can't come to you. That is a reality for a lot of people. In addition, some people sadly will die, and some people are dying, and they're dying alone. I heard a lady say on the news, and it was one of the most beautiful testaments to nurses and healthcare workers. She mentioned doctors as well, that her mother died in a Long Island hospital. And the only thing that made the family felt a little bit of comfort was knowing that a nurse with a gloved hand was there to hold their family members. Ladies and gentlemen, as nurses, doctors, social workers, physical therapists, EMTs, we assist people during the death process. Whatever our role is, we can help them. People call it crossing the rainbow. Whatever your faith with regard to anything after this physical life, it's yours and it's personal. And sadly, COVID-19 and how we have to treat it and isolate it as a public health emergency, many individuals are dying alone. And the loneliness doesn't, or the sparse amount of people, it doesn't end with just in the hospital. Funerals are being limited because they limit gathering more than 20 people. Take a look around your circle, and of course I would like the people that care about me to give me flowers while I'm living, and I have my own feelings about what to happen to me in the event that I die. But my mother once said to me, dead man has no say. So you could plan as much as you want, but on a serious note, how we bury, be it a burial, be it cremation, be it buried the next day, be it wait a month until all the family member could get there. It's a cultural norm. And COVID-19 and this health crisis, because it's a pandemic and a public health emergency, it's affecting how people not only help each other during illness, how they grieve, and how they bury. And these things last a long time. So as a member of the healthcare community, I want us to be mindful of those things. I commend, and I'm so grateful for those people who are in the hospitals, nurses, doctors, social workers, EMT, nurses aide, the housekeeper that's making sure everything is clean according to OSHA guidelines. I am so grateful to those individuals who are there. Maybe they're the only face someone sees before they die. Maybe they're the last face someone sees before they die. What an amazing privilege. What a truly amazing privilege to be with someone as they take their last breath. It is a privilege that we should never take for granted. As a new nurse, I worked on an oncology unit, and I've had that privilege more times than I really want, but I'm just grateful that as a nurse, I was there when no family member or friend could be there. And this is what's happening now. A lot of healthcare workers are there. I want family members to be reassured. Stay in contact with the healthcare team by phone if you can, video chat. Ask them if they could do that. But death and dying as a consequence of COVID-19, it's not only just affecting our mortality rate, it's affecting our human social construct, our cultural norms of how we grieve. I ask you to refer to social services, lean on your faith for those of you have a strong faith. Remember, spirituality is not just religion, but spirituality is just a foundation of how you feel about yourself, our connectedness. I truly believe that we are connected to each other. I really believe that. But in these times and in any time, just remember that grieving, death, and dying, it's not the same for everyone. Situations in society such as this pandemic is now interfering, interrupting, causing a change in what was a family's normal way of grieving and burying. So as we go through our day, I think this is a good opportunity for us to think about advanced directives. With COVID-19, as well documented, in many patients, it's respiratory distress, requiring them to be put on a ventilator. What are your feelings about that? Does your proxy know your wishes? This is a good opportunity for us to take it to talk, not to be grim, but just to be real and have a conversation about your feelings about advanced directives. What exactly do you want the healthcare team to do? Do you want a trial of CPR? Do you want to be in a ventilator until someone decides that? Putting somebody on a ventilator is easy. Taking them off is not so easy. As a nurse, I've been doing this for a long time. But, ladies and gentlemen, all things, be good to yourself. Have a conversation with your family members about your wishes. Have some compassion and reach out to family members who are dealing with this loneliness, knowing that their family member is in an institution being treated and they don't know and they can't be there with them. So, as always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.